In part 1 of this video series, we discussed how healthcare providers can reduce stigma and provide compassionate care for their pregnant patients. Today's video outlines a technique known as screening, brief intervention, and referral to treatment, or SBIRT for short. This is an evidence-informed practice model used to identify people who use alcohol, tobacco, and other substances at unsafe levels and connect them with treatment. This is especially crucial for pregnant patients. Pregnancy is a critical period for the health and well-being of both mother and baby. Substance use during pregnancy can lead to severe complications for both mother and baby, including increased risk of medical complications for moms and preterm birth and low birth weight for babies. Early detection and intervention are essential. Discussing substance use as a routine part of comprehensive obstetric care can also build trust. Screening is the process of identifying substance use. It does not take long and can easily be part of routine patient assessments. These are the screening tools recommended for use with your pregnant patients. It's important to tell your patient that you screen everyone as part of their routine care. It's essential to ask these questions universally at the first prenatal visit. Remember to use language that reduces stigma. In the first video of this series, there are examples for you. You can start by asking for permission before screening. Here's how this looks in practice. Here, Dr. Roberts initiates the conversation and starts using the NIDA Quick Screen tool.
Good morning, Maria. How are you feeling today?
I'm doing okay, just a bit nervous about everything.
That's completely understandable. Pregnancy can bring a lot of emotions. Today, I want to talk about a few important aspects of your health and do a quick screening about substance use. I asked all my patients these questions to make sure you have the best outcomes for you and your baby. Is that okay with you?
Sure, that's fine.
Very good. Some of the substances we'll talk about are prescribed by a doctor, like pain medicine, but I will only record those if you have taken them for reasons or in doses other than prescribed. I'll also ask you about illicit or illegal drug use, but only to better diagnose and treat you. Sound okay?
Okay.
In the past year, how often have you used the following? Alcohol, would you say never, once or twice, monthly, weekly, or daily or almost daily?
I would say daily for part of the year, but weekly or monthly sometimes.
Okay. How often have you used tobacco products?
When a patient's screening indicates substance use, conduct a brief intervention. During this brief intervention, you engage your patient in a short conversation that can raise awareness and motivate behavior change. This approach helps guide patients to identify their goals and values, increase their motivation to address problematic substance use, and set personal goals. Remember, these goals should be those of the patient. Imposing your own goals or expectations can be stigmatizing. Sometimes the patient's goal during pregnancy may be to reduce their substance use or make other behavioral changes to make substance use safer rather than to quit completely. Such harm reduction approaches can be beneficial to the overall health of the mother and baby. The brief intervention may follow this process based on these motivational interviewing principles. First, ask permission to talk about substance use. Next, share information. Then, reflect back by summarizing what you heard. You can enhance motivation for behavior change by asking about the pros and cons of their use. Encourage personal reflection. Then identify a plan of action. And finally, connect your patient with resources. Let's continue with Dr. Roberts and her patient Maria.
Looking at your responses on the screening, your score puts you at a moderate risk level, which means there may be some concern about your overall health if the pattern continues. What do you think about this?
Well, I'm not really sure. I smoke some weed and drink a little, but I never thought of myself as having a problem. But I do know I want my baby to be okay.
So, what I'm hearing is that you use some cannabis and alcohol, but don't think you have a problem with it. And I'm hearing that now that you're pregnant, you want the best for your baby. Can you tell me what you like about your use?
Sometimes it takes several conversations with a patient for them to talk about concerns related to substance use. As you continue to introduce the subject, remember to use non-judgmental language. This helps build trust and opens the door to future opportunities for disclosure. It may take several visits and conversations before your patient is ready to talk. Through this process, you may identify patients who are either at risk and should be further evaluated or express they want treatment. Co-located treatment for SUD and maternity care can improve outcomes for both mother and baby by enhancing access, reducing barriers to care, and improving coordination of treatment. Such co-location of services is not always possible, though. If you do not conduct diagnosis and treatment, it's important to know what services are available in your area for this. Connecting a patient to social work or case management services may also help facilitate referrals. Now let's get back to Dr. Roberts and Maria.
So it sounds like there are some things you like and some things you don't like about your use, and that you might be interested in cutting back while you're pregnant. You know, there are some people and places that would help with this. Would you like to hear about them?
Would I see them instead of coming here to see you?
We'll keep monitoring your pregnancy closely here and providing you with medical care. That won't change.
That sounds good. Then yes, I guess I can hear about those other places too.
You're taking a positive step by seeking help. We'll support you every step of the way. I'll make the referral and we'll set up an appointment for you.
Thank you, Dr. Roberts. I really appreciate your help.
Institutions can help promote SBIRT in clinical practice by incorporating it into existing workflows. Providers should also learn about any billing and reimbursement requirements and opportunities. And remember, all staff should be trained to conduct screenings, brief interventions, and referrals in stigma-free ways. For more information, visit www.carna.com.